Hi, I'm Holly Pavlisak, Program Manager for the Advanced Medical Technology Initiative, otherwise known as the AMTI program. The AMTI program facilitates bottom-up technology innovation at our military treatment facilities and operational units, exploring solutions that fuse data, humans, and machines, documenting their impact on performance, readiness, access, quality, and safety, which provides senior leadership with medical technology surveillance. Next, you will hear from some of our innovators on their AMTI-funded initiatives, so you can see firsthand some of these medically unique and militarily relevant solutions.
So my name is Lieutenant Colonel Carrie Hoppus. I'm currently the Program Director for the Army Baylor University Doctoral Program in Physical Therapy at Joint Base San Antonio. My role has been as a co-investigator and a lead investigator in several AMTI projects. When I was doing my PhD at the University of Pittsburgh, I was being mentored and trained in a technology that was new to me called functional near-infrared spectroscopy, or FNIRS for short. And much like a pulse oximeter can measure changes in blood oxygenation levels, we can use that right over the scalp to see changes in blood flow within the brain. But what we wanted to do was monitor the effects of dry needling. And dry needling is similar to acupuncture, but we use a small needle in physical therapy to try to alleviate the pain that is associated with a tight band of tissue or like a muscle spasm. You could use other mechanisms like fMRI or CT, but those things require that the service member lay in a supine position or a prone position, right? They can't move about. And so what's unique about our technology is that it can be placed into a backpack and the soldier can be doing a military specific task or something that would bring on their pain. And so that's really unique that we can monitor for brain changes in real time. And what we wanted to really answer was, are these dry needling effects only happening at the shoulder muscle, or is it truly influencing the way the soldier perceives pain, which happens up in the brain in the central nervous system? So this was a unique opportunity to try to leverage a new technology in a way that would be soldier specific in the way that they function, and see if we could find any information there to better decide who should get dry needling intervention. We're here to make sure that our service members are fit and ready to fight. And whether that's injury prevention or performance optimization, or to evaluate and treat and expeditiously return them to duty, we have a part to play in all of those. And the AMTI mechanism is really wonderful because you could take a particular clinical question that relates directly to warfighter readiness and lethality and use your scientific method at any point along that spectrum. And that's really where I've headed now. And it's large part because of the ability to use these AMTI awards to leverage partnerships, not only with industry, but also with civilian academic partners as well. It's really been important for me to grow as a scientist. And because of AMTI, I have been able to really develop my skills post-PhD. And it's because of the commitment to the AMTI mechanism that allows us to put the funding and the equipment and the personnel in place to support novel projects that truly will make an impact across the medical or the military health system.
My name is Captain Robert Whitehurst. I'm currently the H2F Injury Control Director for 44th Med Brigade here at Fort Bragg, North Carolina. So my AMTI project revolves around the Raptor, which stands for the Rapid Acquisition Package for Tracking Outcomes and Rehabilitation. And it is essentially a tool for providers. It started with the physical therapy department. Essentially, it's a program that the providers interface with to be able to write the patient encounter note and then collect the data associated with that note all through one same experience. Prior to this project, the providers within the physical therapy department, when doing clinical encounters, would write their note in a Word document, and then and as part of our standard practice, right, we would collect patient-reported outcomes. But those outcomes would go into this text field that would get dropped into an ad note in Alta, and essentially would be lost forever. No way to analyze it or collect it, aggregate it. And so this program was meant to allow us to still fulfill the requirements of the MTF, which are to put all of the patient encounters into Alta, but then we were able to basically extract all of the numbers and data from that encounter so that the clinic could look at how we were doing with our patient care. So now Raptor, because of the success of its templates, has been merged or adopted by DHA into their Clinical Assessment Management Portal, or CAMP. Obviously, DHA's web-based application has much greater reach and accessibility and the ability to troubleshoot, fix things and stuff like that than I by myself had. So now it's going to be able to become much more powerful and to reach more users. Because for us, improving soldier readiness and decreasing disability just for quality of life, helping people to be as fit as possible, all of those things kind of tie together into having a healthy fighting force. Without the funding and support that we received from AMTI, I do not see this program of getting to where it is today, or have getting very far at all, right? Because it's very difficult without resources and support to have the time necessary and to be able to do the efforts to push out something like this, right? It's very much like a grassroots type effort where there had to be a lot of effort put into it, right? So because everyone, in order to have a viable product that people will use, it's got to be basically almost seamless, because the providers that we see don't have a lot of patience for things that don't work. And so being able to have the staff and the support in order to manage all of those things was pivotal, crucial. So would not be here without AMTI.
Hi, I'm Captain Courtney Moore. I'm a dietitian, the chief of outpatient nutrition at Womack Medical Center, and I'm a co-PI for this study.
Hi everyone, my name is Jared McWhort. I'm an assistant professor in the Department of Nutrition at UNC Greensboro, and I am a co-PI of the project. The goal of the project is to meet people where they are. That's kind of the driving idea behind this. And nowadays, most people are on their cell phones, and that's the most effective way to reach people to try and influence their health behavior in a community setting. And so what we've tried to do is take a multi-layered approach that sends place-based healthy eating messages to soldiers to make them more aware of healthy food in their environment, and also to nudge them to make healthier food purchasing decisions when they are at the decision-making points within the food store environment.
So 1 in 5 active duty service members are overweight or obese, and that increases the risk of musculoskeletal injury, days of non-duty time, and non-deployability. So this technology can help address the obesogenic food environment by bringing awareness to healthy food choice options that are on post. And this can help to address this obesity problem by bringing those healthy food choices by having those nudges to encourage service members to make healthier food choices by bringing that awareness to where those healthier food choices are.
And so whenever people are interacting with the food environment, they are both experiencing this large environment as well as this smaller environment. And so we tried to address both. And so the larger scale environment, we're using something called cellular geofencing. And so this is a digital technology approach which sends place-based marketing messages to a person when they come into a certain area. And in our context, we're talking about a certain area of the military base. And so, for example, we're setting up these geofences, so these virtual fences or virtual perimeters around healthy food venues, with the idea that when a soldier comes within that virtual perimeter, they will start receiving healthy nudge messages to make them aware that there's healthy food in that location.
So I think it can improve readiness just because a component of readiness is being like physically fit and meeting the like Army body composition standards for like height, weight. And a portion of that is like the food choices that you're making are going to influence like your weight. So if we can encourage healthier food choices, that can put someone on track so that they do not get flagged or they're not considered meeting the standards for the military when it comes to like height, weight.
I definitely think that there's potential to scale this across Army bases, and I think the larger idea or goal of all this is that we're going to make the whole experience interactive, and that people will become more engaged and more intentional with their food environment, with the dietary or food purchasing decisions that they make.
My name is Chuck Anderson. By trade, I'm a vascular surgeon. I've been at Madigan Army Medical Center, where I currently am, for about 40 years. I've been very, very involved in limb preservation. That has been a team approach using vascular surgery, advanced podiatric care, and wound care to prevent amputations in diabetic patients. And we've been very successful in doing that. When you're taking care of chronic wounds, it's critical that you're able to ascertain whether bacteria are present in those wounds. More and more, there's a realization that bacteria plays a major role in chronic wounds. In fact, there are now models where the wound care is based around bacteria. So our project was to utilize a scanner which is able to pick up bacteria at a load greater than 10 to the 4th. It's a handheld device. It's a fluorescent imaging, and we take an image of the wound, then we turn the lights off and we do a fluorescent imaging, and bacteria will show up either as red, or Pseudomonas shows up as a bright white color. So at point of care, we're able to determine whether or not there's bacteria on the surface or in that wound, and then we can adjust our treatment knowing that there are bacteria present. Number one, clinical judgment alone does not pick up the bacteria. So the problem is, again, based on now some very good studies done elsewhere and also supported by our work, that if you don't know that there's bacteria there, then you can't appropriately treat it. So the problem that it solves is that it tells us whether or not there's bacteria. In the past, if we were concerned about bacteria, we would have to take a culture, and then we would have to wait for the results of that culture to come back, and then we'd have to have the patient come back to adjust treatment. Now it's point of care. You can see immediately whether there's bacteria present, then you can adjust how you're going to treat that wound. It has an impact on every aspect of what we do with wounds. Dressing selection, debridement, use of advanced wound care products, all of that is impacted based on whether or not there's bacteria on the surface of that wound. First of all, I have a big sign over my desk that says the patient is the center of the universe. And I think if we focus on patients and try to get those patients over their acute or chronic illnesses and back to a functional life, That's the goal. And this device has allowed us to do that in a much more rapid fashion. It avoids the overuse of antibiotics. It avoids unnecessary admissions. And it heals wounds that I think otherwise, because we would not have identified the antibiotics, could have well progressed into limb-threatening, even life-threatening wounds.
If you would like more information on the AMTI program, please visit us at the following website: